Thank you very much, Director Tan. Thank you very much, Ruf. I'm very happy to give you few ideas for this webinar. Please be aware that my mission is not to talk about digital tools. I refrain myself to talk about that because the distinguished speakers we're going to speak after me are going to talk about that. My role is to set the scene of health and well-being education and the relationship between health and well-being education and the school curriculum. Um, I just would like to share with you five simple key ideas that will help, again, to set the scene and to put in perspective the different contributions of the speakers that are much important on mine because they are really focused on the digital resources we have for health and education. So my five ideas are very simple. First of all, why do we take into account health in the school dynamic? The second is why do we have to have a global perspective? And that's why it's so important to have colleagues from all the continents here as speakers as well as participants. Then I will give you a few ideas about the way in which we could shape the content of the health education curriculum. And then the two last parts of my talk, the ideas 4 and 5, are about how to do it. Because it's not only a question of having a good idea. The question is how could we help every schools on the planet to take health into account, to take well-being into account in order to improve health education and health achievement. So first idea, all of you know that the health and education are inextricably linked through one thing. First of all, because you need health to be able to learn, and education is a key component of health. And we always need to think through the point of view of the health sector and from the point of view of education sector when we want to talk about school health promotion and school health education. From the health sector, what's important, this is the iceberg. Why the iceberg? Just because you know the iceberg, you can see only 10% on the surface. The most important of the iceberg is not visible. And it's the same for determinants of health. When we talk about health, we think hospitals, we think doctors, healthcare setting, but you all know that more than 80% of the determinants of health are linked to biological, socio-cultural, environmental, behavioral, education factors, and all of these are linked to education. So from a public health point of view, it's absolutely critical. That's a priority. Never forget that 20% of the global population is in schools every single day. Of course, from an educational point of view, this question is different. It's about, first of all, creating the condition for educational success, because you need to be healthy and to live in a supportive environment to be able to achieve in the field of education. And it's also because health education is an essential part of culture that is handed down from generation to generation in all civilization. So you can see that there's a kind of common interest in having strong school health education policies because it's really part of what could help cities, countries, territories to be healthy and resilient. And then that's why we really needed to focus on what makes possible the commitment of schools to health and well-being. This is all the more important as you all say that in terms of health, our world is really inequitable. It is true between countries, but it's also true within countries. And yeah, you have this classical figure from Michael Marmot showing that the life expectancy is extremely different depending on the social background of the people. And why do we need to strengthen health education and promotion in schools? Because this is one of the best way to contribute to reduce health inequalities and to remove most of the obstacles for people to be healthy. I'm just not saying that from my point of view. This is based on the review that we made within the UNESCO chair, and that shows that universal approaches, it means approaches that targets all the kids in school, and also targeted approaches that are more focused on the children and young people in vulnerable situation. Both of them are clearly efficient and effective. This is absolutely critical to remind that health education and health promotion in schools works. But more than that, when you work about this kind of programs from an economic perspective, data showed clearly that the return on investment of the school health promotion and education programs are high. It means they are really cost effective. So it's not only about, building the competencies of the population, which is critical, but it's about reducing inequalities and doing so in a way that is cost effective for the cities, the territories, and the countries. What we know from research, and probably most of you know, is that for that kind of programs to work, you need to take together the school health promotion policy, the school climate, the environment, the relationship with the community, the link with the healthcare sector, and of course, the school curriculum. It was my first idea. The second idea is that we must speak from a global point of view. We must work together. You remember when you were young, the planet was very big, but now we all know that, in fact, it is very small. And we are more and more aware of the importance of the interactions between all of us and also with all the living beings. And this is true that now most of the determinants of health are common to all of us, from east to west, from north to south. So adopting a global perspective when we think about health education and health promotion in schools is absolutely critical and needed for the next years. It has to help her to stop thinking, from our own perspective. You all know this metaphor, this story about the gentleman who lost his keys in the street, and he was just trying to find his keys under the street light, not because he lost the keys on the street light, but because there's light here and it's easier to search. We need to move from that perspective, which is really limited to very few sources of data, to a global perspective, because now more and more we have a lot of lessons that we can learn from, solutions created in the different countries, in the south, in the north, in the west, and in the east, not only evidence-based practices, but practice-based evidence. And this is, for me and for the UNESCO chair, and also for the IITE, as Director Sanchez said, it's absolutely critical to move from a very limited and narrow perspective to a global one. This is my second idea. The third idea is about the content and the fact that children and young people learn about health in different settings. Of course, in schools, but also in after-school programs, in all kind of municipal different settings, museum, libraries. They also learn within the healthcare system. When you meet a nurse, a pharmacist, or a doctor, you learn about your health. But it's also the case in faith communities, associations, and finally, because this is absolutely major, from the family and the mass media, the social networks, and the media on demand. What does it mean? It means that if we want to think about an efficient way of promoting the health of children and young people, we need to think about the school setting, but also the school setting link to the entire environment, the ecosystem of life of children and young people. And probably Tigran gonna use this slide later during this webinar. But never forget that the sources of information about sexuality and reproductive health are, first of all, friends and peers, the digital spaces, and then schools. And we need to mobilize these three different sources of information to contribute to the health of children and young people, knowing that 93% of them, and this is the work of the UNESCO IITE, regularly search data about bodies, sex, and relationship in social media. So what we need to do all together is to think from the perspective of the children and young people, with clearly the school at the very center of the ecosystem of life of children and young people, but connected to the entire, I would say, ecosystem of life of the children and young people. What to learn? What content for health education? Just in few words, because you'll talk about that later. It's always to think from the personal and the individual perspective and the collective perspective. That's why we always talk about health literacy. What could I do to protect and promote my own health, but also citizenship for health, meaning how could I contribute to the decisions about health as a citizen? These two elements are the two components of health education, and this is what we want to promote. And there's, at the global level, different tools to help cities, territories, countries to build the health education curriculum. This is the global standards of WHO and UNESCO. There's also examples in many countries, in all of our countries. This one is the health education standards in the USA, with, on the one hand, the themes, the concept, the facts, and on the other hand, the health skills. Most of the curriculum are based on that. In general, what we all have to have in mind is that to have healthy citizens, we need to help them to build core competencies, of course, languages, mathematics, to have cross-curricular and transversal skills that are the classical communication skills, emotional skills, and all the decision-making skills, and to have competencies related to different themes that could be addiction, sexuality, and reproduction. This is clearly where we are. Of course, that's a complex domain, but it is absolutely major. Knowing that kids learn from different settings, family, clubs, association, and schools, we need to try to create a coherence, to put together these different contributions through what we call a health learning pathway that could generate around the kids, different kinds of educational intervention that will help them to learn about their health through the different settings. And of course, it's all over the life, and especially when kids are young. To do that, we have to have in mind that the key question is not only to implement key programs. It's first of all to close our mouth and open our ears, and to value what already exists in schools and in the community, to share it, to align it, and to improve it. To finish my talk, I would like now to move to how could we move together. And we really know now from research that the key issue is not to implement new curriculum or new school health program. It's more to contribute it to orienting and supporting social change. And as the cartoon, so that of course it's difficult. It's difficult for many reasons. And the first one is that it's hard for people to change their practices. But if we want to move forward, research shows that solutionism, we have the perfect intervention on sex and relationship education, and we just have to implement it. It doesn't work. What works is to contribute to increase the motivation and the agency of all the people involved in the health education and promotion of children and young people, school staff, health professionals, activists, unionist policymakers. The two keywords are motivation and agency. This is what we have to take into account. Of course, one of the key difficulty is that the teachers, especially just like this a gentleman, are, overwhelmed by the different tasks and the pressure. So if we want to add one box on this bicycle, the gentleman going to fall. We cannot do that. If we want to move together, I think we are talking about change, process of change, we need to show that health education and promotion contribute to create coherence within the professional activity of the teachers and whole school staff, and then to help them to work on their professional identity and then include health and well-being within this professional identity through in-service and pre-service training. The key element is that it's a question of coherence. And then instead of having a millefeuille of different competencies and requests to the teachers, our main role in our field is to help them to make a mayonnaise, putting together in a coherent way all the different tasks of the teacher. What is true for the teachers is also true for the healthcare professionals who have a very important role in the health of children and young people. To finish my talk with the last idea I would like to share with you is that how could we do that? How could we contribute to build agency and motivation through the people? To do that, we have some barriers, but also some levels. The first level is the creation of the condition for intersectoral work, education, and health. Among the levers, this is supporting schools concretely where they are in doing a better job. This is also supporting associations, municipalities, sports club around the school to contribute to the health and young people, and also to contribute to the mobilization of the healthcare and social professionals around school. This is what could contribute to change in favor of health for children and young people. To do that, we need to create what we call ecosystems for knowledge production and sharing, put together people who are involved in the field. It's practitioners, policymakers, researchers, together to work together in order not to implement the best intervention in the world, but to improve the quality of the environment and the services in schools rather than implementing ready-made universal solutions. This is what we could do, knowing that you cannot create health without the people themselves. It means the staff and also the children and the young people. So my 5 ideas were, first of all, how we could contribute to integrate health and education in the curriculum. The second is about the fact that we need to be global. The third is about learning for health. The fourth is about orienting the social change toward supporting the schools to take health into account. And finally, the need to build ecosystems of knowledge production and sharing together to the professionals. What we're going to talk now is about, the digital dimension of education, which is, as Director Sad said, a key part of education now. But even if it's digital, even if it's face-to-face, we cannot contribute to health and well-being in schools without the people themselves. Nothing about them without them. This is the key word. We need to work with school staff, parents, families, children and young people to move forward in the field of health and well-being education in schools. Thank you very much. Over to you, Rolf.